telling you, you want to make sure that you have pen and paper because we're going to go through some things this evening that are going to absolutely blow you away. But to kind of set the foundation and to save talking time, sometimes visual makes things even easier. I want you to understand the landscape of what is taking place right now in healthcare. And I want you to watch a really quick video. It's going to be about 2.5 minutes, but it's going to encapsulate the timing of everything that's going on right now. Then when this is done, I'll come right back and we'll go from there.
More than 24 million Americans signed up for health insurance coverage this year through the ACA marketplace. But will they be able to stay on next year? Dr. John LaPook reports premiums are about to soar, and for many, that could make insurance under the Affordable Care Act unaffordable.
There are a lot of people that rely on the marketplaces to get coverage on their own, and this significantly shreds that safety net.
Joanne Volk is the co-director at the Center on Health Insurance Reforms at Georgetown University in Washington, D.C. We spoke with her remotely.
So there's actually sort of a double whammy hitting here. People are going to pay higher premiums for their coverage. They're going to have less help to pay for them.
That double whammy starts with the costs for people getting insurance through the Affordable Care Act. They're set to go up on average by 15%, the most in 7 years. And as the price goes up, certain tax breaks are going down.
The law in place now that gives people bigger tax credits to pay their premiums will expire at the end of the year. And because of that, they expect that healthy people will not continue to stay enrolled and only sicker people will enroll in coverage.
That's the second punch of the double whammy. KFF, a health policy research group, says the loss of some tax credits will drive up out-of-pocket payments by over 75%. The Congressional Budget Office projects at least 4 million people will lose their coverage. On some level, is this sort of the equivalent of an Affordable Care Act repeal light?
Yes, absolutely. By one estimate, enrollment will be cut in half.
And what does that leave you thinking?
People, unfortunately, are not aware of what's coming down the pike. They're going to enroll in coverage and open enrollment this year as they would any fall, but they may not know until late in the year what their actual consequence will be for their premiums and their out-of-pocket costs.
It sounds like a major fear you have is people don't realize what's about to hit them.
Absolutely.
So, John LaPook, we're going to have the basic journalistic questions. First of all, who is going to be hit by these increases?
It's going to be people who are making too much money to be eligible for Medicaid, but not enough money to be able to comfortably afford insurance.
What about when is it going to hit them?
All right, well, next month, in August, you're going to start hearing from brokers, and it's going to be online, and people are going to be having to choose what plan they want. In November is open enrollment, and the real sticker shock is going to hit them when they have to pay their premiums beginning of next year.
So they will have expected a certain amount, and it's going to be a lot more than they expect.
Yeah, or they may have some warning.
And now tell me about what happens to the health system more broadly if people decide, you know what, it's too rich for me.
Yeah, that's the fear, and you heard about it in the piece. You know, what could happen is that healthy people, this has happened in the past, they say, you know what, I'm going to take my chances. I'm not going to get insurance. Well, the whole plan relies on healthy people paying premiums and not using up so much of the system. So if they're gone, that pool of insured people is sicker, and guess what happens? The premiums go up because the costs go up.
For everyone, Dr. John LaPook, thank you.
Everyone, we are sitting right now in the middle of what some are calling a health crisis. And the reason why is everything that you just saw on that video. It just lays it out plain clear. But I want to start by saying, really, the Affordable Care Act was never really affordable. It was being propped up by these tax credits, and the current government says, hey, look, we are not going to continue to fund these companies with these tax incentives. So the burden now shifts to you and I. But I don't believe that most people understand. And you may be thinking, oh, this doesn't affect me. I've got a really good job. You know, my company is paying 50% or 60%. And let me share this with you. It's affecting people. It's either affecting you, it's affecting people you know, but it's not like any of us are really going to escape what's going on. The healthcare system in the United States is in a desperate need of some sort of a change. And what we're finding is I'm getting these calls about letters people are receiving. They're looking at increases of, I have someone who reached out to me that knows what we're talking about. They were telling me that their premium from last year to this year is going to go from $300 and something a month for themselves to over $500. And I think that's a big jump. I don't think proportionally their incomes jump that much. And so what we're talking about is as Americans are facing these choices, with healthcare, what if there was a solution? And we 100% know that we have a solution, and the solution is called Impact Health. So I own a business for myself. I've been in business for myself full time for 27 years, full time. And before I became a member with Impact Health, I was paying $2,300 a month for myself and for my family, five of us, with, a major insurance company. When I came across Impact and I did my quote, and my quote came up to be at the time, it was just around $400. Let me tell you something. I was in shock because I was so used to paying a couple of $1,000s. And guess what? We never went to the hospital. We never went to the doctor except for our annual checkups. Impact has had no across the board rate increases over the last 5 years. All right. Also, the average savings right now is 30 to 50%. Well, you think about it like this. If rates are already going up and there already is a savings of 30 to 50%, that is massive. All transparency in pricing. When I had my previous companies, I would send money into the ether, into the cloud. I had no idea where it was going. I had no information on it. I'd send them money, and if I need to go to a doctor, hopefully everything worked out. With Impact, I have a portal. I can log in. I can see where my money's actually going, what it's contributing to, how the community at large is doing. Everything is laid out with total transparency. One of the things that I think is massive is the fact there are no provider networks. So let me give you a quick story. I wanted my family to have a comparable plan to what I had when I was working in pharmaceuticals. So I got a plan called a PPO plan, right? And so I go and I have to have a procedure done. And you get a PPO plan because they say you go to any doctor. Well, that wasn't actually true. I found it was any doctor inside the insurance network that I had. How did I discover that? When I went to have a procedure done, I came out and later I received a bill for $3,000. And I said, what is this bill for? Because I went to a doctor, I had the procedure with my doctor. They said, yes, that's for the anesthesiologist. I said, what are you talking about? How am I supposed, how many of you would have no idea that that was a thing that was billed separately? And I'm paying $2,300 a month to then get a $3,000 bill, not understanding that the anesthesiologist wasn't covered under my PPO plan. It cost me $3,000 to learn that lesson. When you have a plan that has no networks, that literally means no networks. That means you have the ability to go to the providers you choose, to the hospital systems you choose. We in America pay more in healthcare than like any other country in the world. Wouldn't it be a good idea to be able to go and choose who you actually want to go and choose, as opposed to being told who to go to? And because this is a not-for-profit, the toughest part for me when I first became an Impact member was understanding that for my entire adult life, I'd only ever experienced for-profit healthcare. I'd never experienced a non-for-profit. And the experience of that was because these entities are for-profit, I'm not just paying for my healthcare, I'm paying for the profit margin. So when you remove the for-profit, think about why should your healthcare be based on the profit margin of some major company? Like, what about healthcare that's just actually based on providing healthcare? And so when you strip out the for-profit nature of it, then you see the pricing that actually makes sense. You see the care that actually makes sense. In the last 5 years, Impact has shared or saved over $275 million for all of the members. You're talking about healthcare that's privatized. You're talking about there's been no across the board increases, I said, in the last 5 years, and the platform shows you everything. It's really simple. Think about what do you do right now with your current insurance, or if you're a business owner on here, and you have a staff. I just met with a business owner today. They were paying about $1,000 a month. They were subsidizing their employees. They were covering 70% for each employee. They were paying about $700 a month for the care. They got the renewal conversation with their broker. It was going to cost them for this upcoming enrollment season over $970, where it was just $700 for this year per employee times 30 people. So when they got, so here's what they said. They says, let me get this straight. They're going to save right now with Impact about 63%. That's what they're going to save. But not only that, they have a portal that's going to show them everything, complete transparency, where the funds are going, the allocation of everything, the allocation of the membership, everything is broken down for them. So for individuals, for self-employed people, families, entrepreneurs, gig workers, industry workers, seniors, if you have Medicare Parts A and B, small business owners, up to 49 full-time employees, you're all eligible for Impact. And what that means is that you actually have choices. Like there's no contracts with Impact. The list of what Impact does versus anything I've had before. I used to work for two of the 10 largest pharmaceutical companies in the world. Two of them. And what I have today, I've never experienced anything like it, even though I was working for those tier one companies. We have what's called a PRA, and a PRA is essentially our responsibility. So in the world of insurance, it's called a deductible. It's the exact same thing. PRA, deductible, exact same thing. When you meet your PRA, Impact will pick up 90% responsibility. You're responsible for 10%. Any new accident, illness, injury. But then on top of that is something that is actually a big deal. So I'm going to give you this concept. Do you know that my mechanic told me something once, and I said, why did you become a mechanic? And he said, because people's cars break all the time. And I said, that just makes sense. And here's what he told me. He's like, mechanics need broken cars. Okay, well, let me translate this. Do you understand that if you actually stayed well, like if you actually stayed healthy, do you know that the hospital system would have problems? Like, what if everyone on here was really incentivized to actually stay healthy? How about that? Impact has a wellness rewards program. I want you to listen to this. So, first of all, there's no waiting period for the enrollment, right? So, when you become an Impact member, it starts on the first of whatever the next month is. Telemedicine is included in your plan. Concierge services included in your plan. Prescription savings included in your plan. As of last year, over $6 million were saved by members in just 2024. Vision and dental discount program included into your plan. They're giving you all of these things, but on top of that, if you have anything that you are doing to keep yourself medically well, to keep yourself healthy, they're giving you up to $150 every single month that goes towards your PRA, your deductible in this language. So think about gym membership. You go to a naturopathic doctor. You go to a fitness class. You do your Pelotoning. You do your massage, acupuncture, supplements. Lord knows I've got supplements all over my office. All I have to do is simply upload the invoice or receipt of those things, and they're crediting you every single month towards your PRA or slash deductible. What does that mean? They're giving incentive for you to be well, to stay healthy. By the way, I'm particularly leaning towards the massage. I think that's an ultimate part of my wellness, but I'm telling you, that's a big deal, as well as two major partnerships, Doctegrity as well as Levinity. So what does this mean? So I want you to imagine that a lot of people that take medications today, for instance, they're on generic medications. Up to $10 with Impact's new partnership is going to be free. So if you're on some generic, up to $10, it's free. But then also remember, they're always giving value with regards to the other brand name medications on the marketplace. But also telemedicine. Telemedicine happens to be one of the fastest growing areas of healthcare. Why? Because some things don't require necessarily for you to go into the hospital or even to urgent care. It could be something really minor. Well, how about this? You hit an app, the doctor pops up on a phone call or on a video call, diagnosis, you're able to go. We have people that travel the country that have been using telemedicine with us wherever they go to. But why is this important? This is included. There's no additional cost. So Impact is providing all these additional services, and they're not giving anything a la carte. It's all included inside of the membership. So for me, one of the things that I had to transition myself, and for all of you that are guests on here, I need everyone on this Zoom to dial into 2025 because in 1995, we wouldn't have been able to have this conversation. But things have changed. We are in a new world. And look, we don't have corded telephones in our kitchens anymore. That's not what we do. We've evolved. Why can't healthcare also evolve? And I want you to have an opportunity to hear from a young lady who's helping to spearhead all of this. You know, I am a partner with Impact. I refer people to Impact. You're able to create, if you choose to do so, an ongoing, continuous residual income. Why is that a big deal? I would have told people about this anyway. Are you kidding me? I went from $2,300 a month to $456 a month. I don't need to be motivated to tell people about something that's saving me about $1,700 a month. But to give a further understanding, I am so grateful that this young lady is willing to take her time. She does not have to do this, everyone. This is the vice president of operations for Impact. Now, I want you to stop and think about this for a second. What would it take for you to get the VP of operations for your current insurance company to get on a Zoom and talk to you? That is called not happening. So for her to take her time to go through this information, I really want y'all to do me a favor. Please pay attention. Please listen because she's going to give some incredible insights. Please help me welcome onto this Zoom Vice President of Operations for Impact Health Sharing, Miss Eileen Ryan. Ma'am, it is all you. Thank you for taking your time.
Thank you, Mr. Adlam, and his beautiful wife, Danielle, as they call me Young. He just has to say Young before my name, and I'll join any call. Thank you for that lovely introduction, and you do a phenomenal job, as always, representing Impact. As a not-for-profit, we get to save people money on comprehensive health care and do it with joy because you know what? We don't benefit at all personally, nor does Impact the entity benefit if more and more people come into the sharing community. When more and more people come into the sharing community, what we have to do as a not-for-profit, because we do not have access to your sharing dollars. That's your money that is in a third-party fiduciary account that's used solely for your medical bills, right? So if more and more people come into the sharing community and they're healthy and our financial reserves are healthy, we have to turn and look at one another and go, how can we give back more? How much more can we give to the members? So last year, as Mr. Adlam so well stated, we decided, you know what, let's help them pay down their what we call a PRA. Those of you in the insurance world know it as a deductible. Let's reward them for doing things that they do anyways, like get a massage, drink protein shakes, women, your bioidentical hormones, whatever it is, massage, acupuncture, Peloton, yoga classes, whatever they're doing to stay healthy. Let's let our members submit $150 a month in receipts, and we will apply that towards their PRA, what we call a PRA, what you know in insurance as a deductible. So that's one way we gave back. Then we said, you know what else can we do? Well, if you're an Impact member, you just got the email today. We launched Octegrity and Livinity, our new telehealth and our new prescription program. And I'm going to show you in a minute just how robust those are. We pay for those, but you do not pay for them. And you'll see like the members get 3 teletherapy visits a month per topic at no cost. They get prescriptions that are generic, $0 if they're $10 or less. They get the high expensive specialty prescriptions steeply discounted. So we pay for these things, but again, our members do not. So that's the joy that we have in what we do is as a not-for-profit, we just look for ways to make this better and better. So before I get started, I wanted to share with you in the video that James shared with us, the gal said, it's a 2-punch. It's one that insurance rates across the board are going up, the biggest insurance rate hike in a decade. And at the same time that those rates are going up, there's changes to the ACA, the Affordable Care Act marketplace. Some of you know it as the ACA, some of you Obamacare. Each state calls it their own, like California calls it Covered California. But I want you to know that those are all synonyms. It's the same thing. It's the ACA marketplace. It's where consumers go to purchase their insurance from Blue Cross, Aetna, United, and it has been since day one, since 2010, subsidized via tax credits by the government. So at the same time that the rates are going up, these tax credits are going away, and they're also making it more, I'll show you in a second, more personal responsibility. You're going to have to prove income levels, so take some more steps. So one thing the gal said is, people don't know. And I agree with that. I don't believe that people know because people are busy, and because they're busy, they're not really paying attention. So I know that my neighbor owns a business, and I've been bothering her for a month. Sharon, be on the lookout. Be on the lookout. You're going to get a letter from your insurance carrier letting you know about the ACA marketplace changes. It's not going to be the same old, same old. Like, don't think you're just going to get insurance next year at the same price as this year. Sure enough, Blue Cross Blue Shield of Florida sent her letter on it. It said, important government changes that affect your rates. I said, if she didn't have to give me that letter, she probably wouldn't even opened it. People are busy and they think, oh, what could be so important? So in it, they sent a link to this page, and I want to play this video for you.
This fall, during open enrollment for insurance, you'll see changes the government made to how people enroll in or renew health plans on the health insurance marketplace and the amount of financial assistance available. These changes will apply to anyone buying a plan on the marketplace from any insurance company. So it's important to be prepared and have a plan before November 1st. Let's talk about some of the changes and how Florida Blue can help. First, if you currently get financial help from the government to help pay for your insurance, also called a subsidy or tax credit, you could get less next year. You most likely will see a big increase in your monthly insurance costs starting in January. Second, you'll have fewer opportunities to enroll outside of the open enrollment period that starts on November 1st. And third, more steps and information may be required when you enroll. So, what should you do? This year, more than ever, you may need guidance to understand the government changes and have everything ready so you can enroll and get the most subsidy you can qualify for. Go to floridablue.com/stay covered for more details and connect with an expert for help. If you don't have an agent, you can call us at 1-844-396-3001 for help finding a plan that meets your needs and budget. The enrollment and renewal processes may be different than you remember and will likely take longer than before, so it's important to have a plan. Florida Blue is ready to provide expert guidance at no additional cost. We're here to guide you through the changes. Visit floridablue.com/stay covered.
The insurance companies are trying to express that there's three things that's going to happen. The tax incentives are not going to be the same. They're either going to go away completely or be lessened depending on the situation. The window of time that you have to enroll in open enrollment is shorter. And then there's another requirement is they're going to require not only that you have filed your tax return from 2024, but that you filed with it a form 8962. And that form, now Sharon, my neighbor who gave me all this documentation, she said, oh, I did my tax return, but I didn't do that. So she had to contact her neighbor. Thank goodness Florida Blue put all this in, her accountant, Florida Blue put all this in a packet for her to understand. And I was actually reading it and going through it. But people, they're not going to know. They're going to think it's the same old, and millions of people are either going to lose their health care because they're not paying attention to what's going on, or they're going to lose it because they cannot afford the changes. So here in Broward County, I live in Fort Lauderdale, they also gave an example. If you're with Florida Blue and you're a family of four making $78,000 last year, you were paying $232 because you had tax credits. This year, you'll pay $648. So there's a lot of people that are going to end up having to leave the ACA marketplace because they simply will not be able to afford healthcare. And to James's point, those will be the healthy people. They're just going to be out there winging it. Like, I don't know, I get an accident, I have a heart attack, I get cancer, I get pregnant, my baby ends up in the NICU. Like, I'm just going to have to deal with it because I can't afford these high premiums. And this is where you come in. All you're doing is you're sharing with them something that many do not even know of. They've never heard of healthcare sharing, and they don't know that there is an affordable option out there for comprehensive healthcare. And I honestly just want you to think of just that. You're just sharing information to try to help people. Because it's not a sale. You don't have any attachment to whether or not they do or they don't join Impact. You're just presenting it to them and handing them to us if they have any specific health questions. So I wanted to, I thought it was important to go over that. All right. So welcome to Impact, where Impact, as I said, is a not-for-profit. We get joy in what we do because we can. First thing, when you share Impact with people, the first thing they notice is the price, how very affordable it is. And they're going to say to you, how is that possible? And your answer is simple, because it is a not-for-profit, organization. They have no profit motive. And as I said, the more profitable we get, the more we have to give back to the membership and make it more robust. So that's a joyful thing for us. So that's your answer to that. Now, members, today you got notices of two things, two new programs that we pay for, but are going to make your life better. As soon as you come into the membership, day one, you get a concierge service for wellness. So you schedule your wellness visit, we call ahead and we prepay. Why? Because we want our members to stay healthy. As soon as you come into the membership, day one, you can get unlimited telehealth visits, right? No cost, you and your family. But also now you can get short-term teletherapy. So with this new program that we rolled out, you can get teletherapy visits, 50-minute visits with a therapist for any 3 visits a month for any new topic. So 1 month it might be anxiety. Next month it might be my kids are driving me nuts. I have parenting issues. Next month it's stress or life changes or anger, whatever it is. You just have to pick a new topic to get the 3 new visits each month that are of no charge to our members. I want you to think about that. When we've shared this with people, we've had people tell us, you know what? We have children, 14, 12, that just, we feel like they're just so stressed from social media and from being a young person in today's world. And we're so thrilled that they also get this. Keep in mind, every single member of the family gets these 3 visits per month, per topic at no charge. That's phenomenal, and it makes our hearts feel really good that we were able to launch this. It's called Doctegrity. And then in the member center, you'll see where it says under Doctegrity coming soon, because we're also launching a tech part of Doctegrity, which is a facial scan. And in that scan, it will tell you what your blood pressure is, your heart rate, if you should go see a doctor. Well, we recommend, if you're scheduling one of your telehealth visits, like you're not feeling well, that you just go in front of a camera and do that facial scan before you get on a call with the doctor, so that they'll have your vitals. I mean, you don't have to, it's not necessary. My friend, my colleague at work does it all the time, and quite frankly, sometimes it stresses him out because he thinks he's feeling good. And he's like, well, it says my blood pressure is high. Well, probably is, because you're worried about what the scan said. But we're super proud of this, no cost to our members, and we launched that today. The other thing that we launched is a new prescription program. So all of any generic that is $10 a month or less will now be free. There'll be no charge to our members. But the other thing that we launched, so here, like I put in one, no, I don't have diabetes, but there's a longitudinal study on metformin for anti-aging. So I've been taking metformin the last year, and it is $0 to me, because it's one of those drugs that, fits into that price range. But I want to show you another thing, is specialty medication. So this is a drug that people take for osteoporosis, those who either, can afford it or can go to the website of the pharmacy and get that pharmaceutical company to give them a manufacturer coupon to discount it.
Here, let me see.
EVENITY.
Let me see here if I can. This is it, right?
You found it? There you go. Thank you, my friend. So
You're
look
welcome.
at, scroll down. Oh, by you, it's 2,600. Oh my gosh, all the pharmacies by me were 25. Look at that. So you see the variance. And by the way, can you stop for a second? It's the same medication, but every pharmacy gets the medications like in different lots. And so they get different allotments at different prices. Same medication, different price. Scroll back up to that top one. So through our specialty, all the way to the top in the blue, through our specialty pharmacy or mail order pharmacy,
Wow.
you can get Evenity for $25. This is a drug that people with osteoporosis take once a month. So we're super proud of the fact that our members now get the 3 free teletherapy visits, the per topic, and the generic prescriptions at $0. And we have this program for specialty medications. Listen, guys, some people will want to come into Impact and join just for these specialty medication rates. Okay, so take a moment to familiarize yourself, play around in there, put in different drugs and check it out. Yeah. Exciting. And we're excited, Mr. Adlam, because we get to do it. We're working on more things now. Those 2 programs launched today, and I have a call with the CEO and a consultant tomorrow on something else that we're looking to launch to bring more value to the members. Pay attention to this. James told you 5 years we have not had an across-the-board price increase. So we continue to add because we can, and we have not raised prices. So that's a big deal. We take a lot of pride in the work that we do. So I think I'll open it up to questions.
So, first of all, that's crazy what I just saw. That's crazy. All right. So, thank you for what
Yes,
you're doing.
absolutely.
And I'm just going to scroll through and kind of go back a little bit here and see about getting a couple of questions. So it says, what if I already have insurance through my employer? Will Impact cover me as the primary or the secondary insurance? It's not Medicare. Thank you.
Yeah, so that's called coordination of benefits, and there's like law that governs that. Your primary is your first, it's your main. So I would not recommend that you pay for Impact, because why? Why would you? What would we be able to do for you? You wouldn't do it for the free telehealth or the teletherapy. I would just stick with what you have.
Got it. Thank you, ma'am. I have another question here. It says that members always have the choice to continue to contribute to the community. Can you please tell me what that means exactly? Number 2, what do you answer a potential when they tell you that they're not interested because it's health sharing? Seems like people are scared of this word. How can I close the deal?
Yeah, no, that's a really good question. So, if you caught what I said, is something we're very proud of. The way that our healthcare sharing organization works is when members come into the sharing community, they get, the rate is based on the age and how many members in your family. Pricing stops at 3. So if you have family 5, 6, 7, you're going to pay the same price. It doesn't increase. Okay. But in that, it lets you know that this percentage of your monthly amount will go to overhead, like admin fees, which is our salaries. And then this percentage will go to program fees, which is what you just saw. The rest is held by our third-party fiduciary, America's Christian Credit Union. So at the time that you enroll and you put your banking information in, you're actually opening up an account with ACCU, America's Christian Credit Union. They're keeping your money in that account, and that money can only be used to pay other sharing community members' bills. Impact, the entity, cannot reach our hand in there and take your money and say, let's go on a company retreat. So they can feel you as somebody representing impact and sharing it can feel really good that we can't touch their money and they can feel really good about that.
Yeah, and one of the things I'll say here is people have this weird belief system, Miss Eileen, I'm finding with insurance. So just there's an organization called the Kaiser Family Foundation,
Mhm.
and they review policy with healthcare. And I came across this from their site, and it says that Americans owe 220 billion in medical debt right now, right now. Okay. So I guess what I'm trying to figure out is, I mean, if everyone's bills are being paid, how do we owe 220 billion in medical
No,
debt?
they're not being paid. You know that. So we also don't do, I mean, look at what happened with the United Healthcare CEO. This young man claims it's because he was in pain and he was denied that back surgery. So we also don't do what's called utilization reviews. So what the insurance companies do is they're for profit, right, guys? So if your Dr. James says that you need $100,000 back surgery, they're gonna dive into those medical records and look for every reason they can not to allow you to have that. They get involved in managing care. And so they'll say to your doctor, you know what? Maybe send him to a few months of physical therapy first, then get back to us and we'll look at it again. That is called utilization review. And so that's one way that they deny. The other way that they deny, you and I never discussed this, but I had the same thing. I was scoped in the hospital 4 years ago, and all of a sudden I get a bill for $1,200 that, oh, just kidding, the hospital was in network, but your anesthesiologist was not. So I had to pay that bill, or it would just go on my, I would be one of those people that would have that on my credit. So there's this misnomer that if you have health insurance, it's just gonna pay for it. And the name of the game is they got to turn a profit. It's deny, deny, deny.
Got it. Thank you, ma'am. There's a question here. It says, hold on one second. Can you have a pre-existing condition like osteoporosis and qualify even if your bill health is not clean for 3 months? I think they're just asking about pre-existing conditions. Can you be an impact member with a pre-existing condition?
Absolutely. So what is going to happen is you will get the medication discount, right? And actually, there's a generic that the most people are on because they don't have access to the specialty medication discounts like we do at Impact. So they take something called Fosamax, which is a generic, which they would get for free. So we don't deny anybody, but we're real big on transparency and we care about people. This is not a sale. So we really want to make sure that they know up front, listen, anything associated with that diagnosis, if you come in with that diagnosis, all we're going to be able to do is reprice your bill. And I say all we're going to be able, we reprice the bills anywhere from 71 to 73% across the board. And that's been consistent the last 5 years. So the members, because it's not our money, the sharing community would not share in paying your bill if, God forbid, you fell and broke your arm due to osteoporosis, but we would be able to discount that bill for you.
Got it. Thank you, ma'am. And to speak to the repricing, we have a business partner, a young lady that that she actually posted in a Facebook group her bill. So right now she's dealing with cancer. I'm going to actually show her post if it's okay, because she wanted people to see how the repricing has affected her. So I'm going to do this screen share, and her name is Stacy. And on the 17th of this month, she put, "I just have to share how incredible my experience of Impact Health has been this year. I had to undergo a double mastectomy after being diagnosed with breast cancer. My total bill came to 268,000 and change. Since my PRA, or deductible, as we say, reset on July 1st, after already meeting it in the first half of the year, my out of pocket was only $4,656. What she did was she actually, Miss Ryan, actually posted the actual bills to show what the repricing looks like. So is it okay if I go through this really
Yeah,
fast?
so look at this bill, 9,400 repriced to $112? No, $1,011. Okay.
Right,
So,
112 actually was her
so
responsibility. Yeah,
yeah, that's her responsibility, but it was eligible for sharing, because remember, she already met her PRA.
right,
We priced it to $1,011.
right.
So that was what the amount that was eligible, but she didn't have to pay that. The sharing community paid that because she just had to pay her 112 because she had already met her PRA. But look at that. This is how they overbill. It's just wild to me. And by the way, PS to anybody who's new to seeing these kind of bills, guess what? We send this explanation of sharing to our members, and we also send it to the providers. This Carey Foundation Hospital, they get copies of it too. And you know what they go? Okay. Because they know, they know in less than 1.5% of the time, they'll push back and say, no, 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 I want the original price. And then, James, I don't know if you've gone over this before with this group, but we have a legal team, we call them advocates, and they will advocate. You'll sign a DocuSign that say that they're your representative, and then they go to bat for you, and they're like, no, we're no, not $38,000.
This was blowing me away. Like this was one of her chemo treatments. It was $191,000. And for everyone on here, look at the repriced amount through impact. I mean, eh, like that
So
is
see there, the sharing community paid 24,478, and she was responsible for 2,860. I don't know what her PRA is, but that was her amount that she paid.
so I just want to give people a visual because when we say that impact reprices the bills, sometimes people have a perception of what that is. I thought because she was willing to share with everyone, that would be really, really potent for people to see. A question, if a specific doctor will not accept Medicare at his practice, can I pay and then bill impact?
Wait, Medicare.
Medicare, Mr. Will, or just let's just switch the question around. What if a doctor says we don't take impact?
Yeah. So, but I do want to help him with his question. Is he on
Mhm.
Medicare A and B or Medicare Advantage?
Go ahead,
Yes,
Mr.
my
Will.
question, I have a
Oh,
doctor, he said he just, because of the headache, he only accept people paying their bill themselves. If I went to
no.
him and paid my bill, could I submit
Yes.
those costs to impact?
Yes. So you know what? We're seeing doctors, a lot of doctors, there's a medical freedom organization where doctors are just getting tired of being ripped off by the insurance companies because they're, taking it's really like a regular provider, not so much hospitals, because they're just messing with the little guy. So a lot of them are going to cash pay only. And yes, absolutely, you can, if your doctor doesn't take any healthcare, you would cash pay and you would just take a picture of that, and right on in your member center, it says submit a bill. You would upload it, and you'll get a text and an email saying we received your bill, and they'll let you know if they need more info on it. But yes,
Thanks.
you can.
I love this statement. The sharing, the word sharing, basically, or sharing word, makes it sound socialistic. How do we avoid the pushback? Well, I was paying $2,300 a month. I'm now paying 456. I don't care if you call it sharing. I don't care if you call it goodwill. I don't care if you call it love and peace. I'm saving $1,700 a month. But if there's anything more professional you'd like to say, Miss Eileen,
Well,
please go
guys,
ahead.
think about it. So they're an insurance company. They're paying, denying, downcoding, whatever. This is more organic. It's going back to the basis, saying it's a decentralized approach, just like they did with Uber, right? They took the power back and said, we're going to give it back to the people. And that's what we've done. We said, you're going to be in control of it. And I didn't even speak to our technology platform, leading in the industry. We just got an email from them the other day that they just got another patent on it. And so it allows for the sharing to take place while you're sleeping. And the sharing just means the payment of your bills. So you can see my bill was paid and it was paid by these community members. That feels better than some strange corporation that's for profit.
Thank you, ma'am.
That's wild. That's the first I've ever heard that one.
No problem. Medicare has stated that a person can only have one supplement. Does that mean if
True.
someone is 65 and older, They cannot have both impact.
That
Um,
is absolutely true. They can either have a Medicare supplement from United, Aetna, one of them, or they can have impact. Because all Medicare, the senior program is Medicare A and B only pays 80%. So you need somebody to come in and pick up that gap, that 20%. And after $1,000 annual PRA, impact picks that up, period, the end, no questions asked. If Medicare paid their 80, we're paying the 20.
so I just want to give everyone a little bit of a history lesson. This is for everyone that's on here. Blue Cross, Blue Shield, I think everybody's aware of them, used to be a nonprofit, right? It used to be a nonprofit. But in 1994, they changed their model to for profit. Okay, so it originated as a nonprofit between with hospitals and healthcare, right? Blue Cross used to be a nonprofit health sharing plan. It's sitting right, and I knew this because the gentleman who's an insurance agent said to me that on their exam that was one of the questions, and he failed that question. So I mean, look, they sold their souls, and that's fine, but we like to keep ours. But I'm letting you know that this concept isn't crazy. This is something that has happened for a very long time,
Oh, yeah,
and it's a
it's
big deal.
for sure. As a 501(c)(3 not for profit, as also you take comfort in knowing like we can't just get paid whatever we want. Like the CEO can't say, "Well, I'm going to give you hundreds of thousands," and you no. We get audited, and we're happy and joyful to do that because we know that we are running a nonprofit organization. So we can only get paid whatever people for our jobs in Fort Lauderdale get paid.
An individual said that they have hold on one second, I apologize, sometimes I think what someone's trying if someone has had a kidney transplant for 10 years and have no problems, they are 78, they have Medicare Parts A and B, pre-existing, because they're when you have Medicare Parts A and B, there are none of those conditions.
No pre-existing, yeah. So they can absolutely get impact as their gap to pick up their gap.
Okay, if someone has a pre-existing condition, will they qualify for the annual wellness check and the $150 lab
Oh,
credit?
of course, yes. And unlimited telehealth and the prescription and the teletherapy, we just would be super, upfront with them, like tell me what you got going on. Not all pre-ex are created equal. You know that. They have high blood pressure, high cholesterol, right in the guidelines it says. As long as you see a doctor once a year and you take your cholesterol and blood pressure medication, then God forbid you had a heart attack or a stroke, that is shared by the community. Isn't that what you have healthcare for, not for your annual blood pressure, cholesterol visit? So it just depends on what you have. Somebody had type 1 diabetes or had Crohn's disease. Trying to think of another one that I would tell them, you know what? No, that we would just say it's just we care about you and we know there's going to be things, and the only thing we would be able to do is reprice your bills. We wouldn't be able to share in them.
If it's okay, I'm going to share just on the pricing side because someone's asking questions about like give me an example of what a quote looks like. So I'm going to do this. There's a gentleman that I enrolled today. He owns a business for himself and his wife. I remember his birthday because it's 2 days after my birthday, 05/17/1976. So with Impact, it says 3 plus. When you have a fourth or fifth person, you're still maxed at the cost for three. So he has a family of six, himself, his wife, and four children. He was paying today, prior to meeting me, he considers me a Jamaican angel. He was paying $3,100 per month for his family. So I'm going, and each one of them had a $6,000 deductible on their plan. With Impact, his plan now with a $2,500 PRA, also what you'd call a deductible, is $2,500. It's going to be 628 versus 3,100. And I think sometimes when we present Miss Ryan, it's hard to sometimes we just don't remember to say this is a shared family deductible.
Family.
So He had a $6,000 deductible. His wife and each one of his four children had a $6,000 deductible. Now it's 2,500 shared. So everything they do as a family contributes to the deductible. That's not including the
We contribute too, yeah.
$150 wellness credit that they're eligible to get monthly from Impact. But he's going to be saving about $2,500 a month
And
for
I want to
himself.
stress, James, we want people to use this. Be strategic, use it. We've approved baby formula. We've approved, people have said, oh, I need this special laundry detergent, right? We just want them to use it. We want to help reduce your PRA. I personally used it last year for 10 months. Once 1,500 came off my PRA, then I told my doctor it's Christmas. Order every lab you can think of somebody my age should have. And so she did. And then I also had a medical grade iron infusion, which that was thousands of dollars, because my PRA, and I'm going to do the same thing this year. And I teach that. Be strategic, use your wellness rewards, and then book everything you and your family need to have done.
That's
Oh, my
awesome.
shoulder's been hurting, go get an MRI, but let us help you reach that PRA.
And for the person that asked the question, the PRA is synonymous with deductible. We just call it a PRA, primary responsibility amount. So we call it PRA. You call it the deductible in the insurance world. What is your opinion, Ms. Ryan? Because we have a lot of people that I'm starting to get word of that are now getting quotes from their companies, where their companies or their business owners are giving them their new numbers, and their new numbers look very different
Mhm.
this year versus last year. Would you be willing to speak to people that are in corporate America? I
Mhm.
yeah, I don't know. I don't know that some people realize they can actually opt out of their company's healthcare plan.
Yeah, only if there's 50 employees or less. So what you could do is you could ask them, listen, whatever you were paying towards that, can you just give me a stipend for it and I'll go into, impact. But the other group of people that you can help, and I'm so glad you brought this up, is anyone that the family is on an employer, a large group, an employer, say 51 employees or more, right? By law, the employer only has to pay a percentage, not the whole amount, of the employee's health insurance. They don't have to pay a penny, and most don't, towards the spouse and the dependents. Well, they are great candidates for impact. Rather than pay that very expensive, employer-based insurance, those folks can come over to impact. So you're just looking for people who are healthy to fairly healthy, um, just sharing with them that they've got this option.
Got it. And is it possible to have impact deducted from my paycheck billed as a pre-tax benefit?
No, yeah. Remember, your money goes into your own shared account that goes with ACCU, so that's how it works.
Okay. What if someone is doing psychotherapy sessions for stress, insomnia, PTSD, pain management?
Yeah, so that if you're already doing that, that's considered pre-existing, right? So that would not be eligible to be shared. But I can tell you that after you run through all your monthly 3 free teletherapy visits, the visits with the teletherapist are only going to be $50 a month. We're going to offset that. $50 not a month, a visit.
A question on here. Yes, could some of the business ID become a member? Yes, a tax ID number, they could become a business owner can become a member. What if the person's on dialysis, they're disabled, and they only have Medicare Part A and B, and they need to get a secondary, especially get a transplant?
So are they on the senior program? They have to have Medicare A and B and be 65. That's, if they're on the senior program, then they can join Impact.
Okay, got it. Thank you very much. Are referrals necessary? What if you want to have an MRI for your knees?
Nope. No referrals, none of that network nonsense, none of that utilization review. Let me see if you really need an MRI, no down coding, none of that. We don't get involved in healthcare. Your doctor says you need that, you need that.
I hope everyone just heard that last part.
Yeah, that's not, we're not doctors. I mean, we do have a medical director and we do have nurses, but they just review the medical records as compared to the guidelines. Like, do you have pre-X or not?
Here's a question for you I get all the time about prior authorizations. Does impact require prior authorizations, which I get from a
We
lot
don't
of
get
nursing
involved in
staff.
care. We are not involved in care. No
Okay.
prior authorizations, no referrals, no.
So what would you say as we kind of bring this to a conclusion? And I want to say thank you so, so much.
Yeah, of course.
What do you see with everything going on right now with the state of things? What do you see for impact, I guess, in the next year, two, three, like whatever that looks like with where healthcare is right now in America?
No, we have such an opportunity to help people. We were talking about that today, like in the next 5 years. And my daughter stopped by earlier and she's like, what are you doing? You're doing another nighttime webinar? I said, you don't understand what's going on out there. And I know I've told you this before, James. I wish I didn't take on other people's stuff, but I feel so sad for people that are going to lose their health care. So I believe that, if we're good human beings, we should be out there sharing this with them. You're just telling them about it, and then you can hand them off to us and we'll answer their questions. We're not asking you to be a healthcare representative, but gosh, there's going to be a lot of families out there that are just not going to be able to afford it and are going to go without you carrying the water and being the messenger.
Miss Eileen Ryan, I just want to say, we're all about freedom and medical freedom. This doctor told me something once that I never forgot when I was a pharmaceutical rep. He said, you can eat right, you can exercise, you can take your vitamins, but at some point in your life, you're going to be in front of a doctor, and the doctor in front of matters. And medical freedom that Impact provides is absolutely incredible. And I just want to say, look, I'm like a evangelist with this company because I see what it's doing for people. I get stories and text messages, and that young lady was not even going to become an Impact member. She'd had an insurance company for a very long time and fought me for months, almost a year, about becoming an Impact member. And now her story, there's just so many stories. I just want to say thank you so much for even hopping on here and doing what you're doing behind the scenes for all of us.
Yeah, of course. Thank you all so much. And I know all of you worked all day today too, and you're on this call. Thank you for caring to learn about impact and, invite me back again. I promise I'll learn how to spell Avinity. Okay.
Thank you so very much,
All right,
Bev. God bless you and your family.
God bless you. God bless you all. Take care. Bye.